Is it important to get help early for delirium?
Absolutely, because the sooner you get the help, the sooner they get treatment and the sooner they recover, with the less damage to their poor brains.
Can you tell me a little bit more about the role of carers in identifying delirium?
Carers know the individual better than anybody, so should be able to catch the early signs in a much more sensitive way than, say, visiting people who won't have seen that individual for quite some time. But the problem is teaching carers what they're actually looking at. So if somebody has been a little bit confused, teaching carers that being more confused than usual is actually quite an important thing. If somebody's more sleepy than usual, that's very important to capture really soon, and so on. And that's minor changes in behaviour that make you think something's not quite right, but I can't put my finger on it. That's when you should act. It's better to act too soon than too late.
How do you think the Greater Manchester Delirium Toolkits and leaflets have helped sort of health and care staff to recognise the signs of delirium and manage that appropriately?
Well, we've got the message out to the health and care staff within the NHS, and I think it's we're definitely getting to see results. A friend of mine's recently been in hospital, got diagnosed very, very promptly and got the appropriate treatment and is home and recovered quite well.
Why is identifying delirium important for general practice?
Yes, so in general practice we're often the first port of contact when people become unwell, and symptoms are often quite unfiltered, so people just tell you how they're feeling and then your job as a doctor is to put that all together into a diagnosis. So delirium is sometimes really tricky to spot and can be misdiagnosed as a simple infection or something else that's causing people's symptoms. And that's really important, because if we miss delirium, it means that we don't diagnose it properly, we don't give the right explanation to family about what's happening, what to expect, we don't put the right management plan in place, and therefore the person's experience and the person's outcome is worse. So delirium is important to general practice, that we get the diagnosis right, that we have all of the right tools to be able to be really good at making the correct diagnosis, but really crucially that we can support managing people at home and support families who are going to be supporting their loved one through a really difficult time.
What are we doing in Greater Manchester around dementia?
So dementia is incredibly important in Greater Manchester. It's a key priority for ourselves and our communities and our patients. Diagnosing dementia early allows us to support patients through the course of their illness and make sure they get the treatment and care that they need.
Can you tell me a little bit more about delirium and what Greater Manchester are doing?
Living with dementia can be really complicated for both patients and their carers. Understanding how their illness may progress or how things might impact them, such as delirium, is really crucial, so they can be managed at home and in the comfort of their own home and with their carers around them. By recognising deterioration like delirium, we can put interventions really early to make sure it is less frightening for both them and their families. What we're doing in Greater Manchester is making sure people have the resources and training available to understand delirium early, access the right resources in a connected way to make sure they can support those individuals at that time.
From your perspective, why is managing delirium across settings important?
Right, so where I work in Singapore, delirium is mainly managed in the inpatient setting. That's because it's mainly well-resourced with all the various specialties. However, we see that patients deteriorate despite them being inpatient because of an unfamiliar environment and lack of access to care for their loved ones. And we felt that there should be an innovative method of caring for delirious patients across different settings. And we wanted to look into managing delirium in the home, in care homes, and we see that it's necessary to build up capabilities in our community partners to better manage delirium across different settings.
Want to visit Greater Manchester rather than anywhere else?
When we were doing our research to see whether there's a similar model of delirium management across different community settings, we found Prof. Emma Vadi's paper about the quality improvement project in delirium management, and we saw that there was a very well-structured integrated care of looking after delirious patients from the emergency settings, the acute hospitals, connecting the primary care and also the community care services. And we really want to replicate what's been done in Greater Manchester, and hence naturally this is the place that we will want to be, and really to hear from the people on the ground what their challenges and what they learned from implementing this pathway, so that we can kind of like kickstart our process as well back in Singapore.